Hello, this is Surya Prakash Gupta, Regional Manager Clinical Excellence at DCDC Kidney Care. Today we will talk about patient registration and clinical assessment. New patient registration is nothing but it is a process in which the name, identity, age and other important personal information are recorded in a database of particular medical institution. We are taking some important details from the patient like patient's personal information, patient's address, emergency contact number and emergency contact persons, some like blood group of the patients and registration numbers of the patients, consultant doctor's name. So we will talk about the personal information. Personal information is giving us the correct information about the patients so that we can easily understand who is the patient and where they belongs from. First important thing is that in new patient registration, why it is important? It is very important because of the medical legal challenges. Second, it's also very important for emergency region and emergency condition when the patients are suffering from any severe complications during the dialysis. And if we have taken the record like suppose doctor have prescribed for blood transfusion to the patient, and if we know the patient's blood grouping and health data if we have, then what actually we can do means we can immediate and easily arrange the blood and transfuse to the patients. It will not take long time to arrange and do the testing, blood testing. It also helps to connect if we are taking the emergency contact number and we are mentioning the emergency contact person name and their relation. So it is also helping in the emergency condition like suppose patient is suffering from any severe complication in that region in those time, we can easily connect with the emergency contact person and we can aware them about the patient's conditions, and if something is required for the patient we can ask them to arrange. So in the personal information we are also taking patient's address like patient, their village, where they belongs from, post office, nearby police station, district, state, pin code, etc. we are taking from the patients. Second point is we are taking contact number of that patient, what is the contact number of that patient, and third point is emergency contact number. During the emergency time whom we will connect, so we are also asking for the emergency contact number and name and relation of emergency contact person. Then also we are in the registration form, we are also updating the date of registration and time of registration. So of course we have to take the consultant details. Consultant details means consultant doctor's name, clinical in charge of our dialysis unit, patient diagnosis like patient is suffering from AKD or CKD or hypertension, diabetic, whatever the diagnosis has been done by the doctors, we need to update in the new registration form. If we decided to provide the dialysis treatment to that patient, if everything is okay, then we have to check our schedule board and accordingly as per the doctor advice we will provide them schedule. Suppose they have required weekly thrice dialysis, then we will give them schedule for weekly thrice and clearly we will update them about the timing and shifting timing like they suppose first shift, second shift or third shift, in which shift we have the open slot and accordingly we will provide them the slot for the treatment. Then we have to take the consent from the patient for information and registration. Patient has given us the information about their personal information, address and everything. So first we have to verify and we have to cross check by their valid ID card like Aadhaar card and voter ID card, everything like information which has been given by the patient is correct or not. So we have to cross check by their valid ID card. And second, after cross checking of everything we have to take the consent as well. So the consent will help us to that the patient who has given us the information is absolutely correct and patient is responsible for that they have not given us any wrong information. As you all know that patient registration is important in our unit. And how to register the patient? There are two types of registration process in our unit. Like first is online. Like in online we are registering the patient through the software. Second, we are doing the registration by manually process. Manually process means what? We have the patient registration form and we are updating all the required details and necessary details in patient registration form, like name, like as I said, that personal information, address, consultant details, emergency contact person, emergency contact details, etc, etc. All the required things we need to update in the patient registration form. Clinical assessment. If we will talk about the clinical assessment, yes, it is also one of the most important thing in a medical and healthcare department. For any patients, we need to do the clinical assessment to know about the patient condition, current status, past history, patient's vital signs, and to know about the patient's allergic reaction or anything. If the patients have, we can understand, and accordingly as per doctor's advice we can provide treatment to the patients. So clinical assessment is a systematic way to obtain and document information about an individual's medical and psychiatric conditions and symptoms, functions, behaviors, personal history, values, preference, goals, and other relevant information, and which is then analyzed using clinical reasoning to identify underlying. Of course, we will do the clinical assessment, then we have to also take the patient personal information. In personal information, first we are taking the name of the patient, what is the name of the patient, age of the patient, gender of the patient, UHID number. After registration, automatically our system is generating one registration number. So the patient registration number needs to be updated in clinical assessment form. So we suppose we have 2-3 patient with same name. So how we can identify that this clinical assessment form is for which patient? So by UHID number or registration number, we can easily understand that this form or this file is for that patient. To identify the correct patient, we are updating the patient registration number. We need to also update in the clinical assessment sheet like patient consultant name, patient arrived from, means patients are coming from where, then blood group of that patient, then mobility status, whether patient is stable or unstable, how the patient came in our unit, by wheelchair or stretcher, by walking. So we have to update these things. Then emergency contact person's name will update, relation with the emergency persons, contact numbers of the emergency person, and valuable belonging if any, like patient is coming with the eyeglasses, contact lens, jewelry, etc. So we have to update these things. After taking the personal information from the patient, we have to do the assessment, clinical assessment. So in the clinical assessment, first what we will check, first we have to check the serology status of that patient. So we can understand whether patient is viral serology negative or positive. Positive means there are 3 types of serology status when the patient is positive, like hepatitis C positive, hepatitis B positive, HIV positive. So we can understand serology status of this patient is negative or positive. So after checking the serology status, we also need to understand about the patient's present complaint. What is the exact complaint of patient at present? So whether patient is CKD or AKD, whether patient is hepatitis C positive, B positive, HIV positive, whether patient is hypertensive or diabetic, on any present complaint we need to update in the clinical assessment form. We are checking past history also. Past history means we are checking in the past history, that from how long patient in dialysis. The second point is that before joining our unit, where the patient were taking dialysis treatment, the last dialysis. And then vital sign we have to check during the assessment time. First, blood pressure, second pulse, third temperature, fourth SpO2 means oxygen level, and then RBS, random blood sugar, and patient weight. Now we will talk about the physical examination. Physical examination is also one of the most important part of clinical assessment. Actually, the physical examination must be done by the doctors, so the doctor can easily understand about the patient condition, and accordingly they can provide a dialysis treatment. Like what we are checking in the physical examination, what the doctor is checking in the physical examination, first they are checking the respiratory system, whether the patient's respiration rate is normal or not, whether they have breathing problem or not. Then cardiovascular system means how the patient's heart is working, whether patient was suffering from any heart disease or not before, patient had cardiac arrest or not before, any cardiac surgery has been done or not in the past. Then we also need to understand about the central nervous system of that patient, whether patient is psychological fit or not. During the patients, during the talking with the patients, their pronunciation, their way of talking, their language, and their everything is clear or not. They are mentally fit or not. So we are checking everything in during the physical examination. Then we are also checking access site, whether access site is working properly or not, and what access patient have, like temporary access or permanent access. So accordingly we can prepare for the treatment. Then we are also checking the pedal edema, whether patient have pedal edema or not, and others also any sign and symptom, and we are finding that we need to update in the clinical assessment form. Now we'll talk about the allergic and adverse reaction. During the clinical assessment, we also need to know about the allergic and adverse reaction of that patient. Many persons have some allergic reaction from different things, like somebody have allergy from food, somebody have allergy from some beverage, somebody have allergy from any medicine, somebody have allergy from any drugs. So we need to understand about the allergy reaction of that patient, so we can provide their treatment accordingly, and we can make the arrangement accordingly. Suppose the patient had allergy from any medication, then we can discuss from the doctor that about that patient, that this patient have the allergy from this medicine, so when the patient will suffer from any complication, instead of this medicine, what medicine we can give, what is the option, because patient have the allergy from this medicine. The second, if patients have allergy from any food, aware their attendant that don't give sweets to this patient, because patient have allergy from this food and patient will suffer. So we can restrict it and we can aware their attendant. Then many person or people have allergy from some beverage also, like water, juice, and glucose, etc. So what we need to do, actually we can understand if this patient have allergy from this drink, so we can easily aware them that don't take this beverage, don't drink milk, don't drink this juice of this fruit, so they can save from the allergic reaction. And then many patients have allergy from blood also, so we can be prepared and we can talk to the doctor about that, and also we can understand that this patient have the allergy from the blood and something, so how their treatment can be planned. Now we'll talk about the PAN assessment. PAN assessment is also one of the most important part of clinical assessment. And what actually we are doing in the PAN assessment, we are identifying that patient, that whether the patient is in chronic stage or acute stage. How to identify it means, if the patient is taking dialysis from less than 6 weeks, it's showing that patients are in acute condition. If patient is taking dialysis from more than 6 weeks, means patient is in chronic condition. So when the patient are going for the consultant, a doctor is ensuring that the whether the patient is in acute condition or chronic condition. No need to worry about that. It is a very easy process to do the PAN assessment. Last, we have to do the treatment plan. If everything is okay, and if it has been decided that we can start the treatment, then we are making a treatment plan. So first, it is diagnosed that patient is a CKD or AKD and he needs to dialysis. Then what we are doing, we are making plan of care as per the patient condition and doctor advice. So we will check their blood investigation report, and if the potassium level is high, means patient is suffering from hyperkalemia, that time we can provide the dialysis treatment potassium free. If patient is suffering from edema and have excessive fluid in their body, then accordingly we can set the ultrafiltration, and we have to cross check with the doctor's advice. After doing all the assessment like clinical assessment, after checking the patient's past history, current status, viral serology test, and everything, means after doing the clinical assessment, what we are doing, we have to make the plan of treatment. So how to make a treatment plan, a good treatment plan? First, we have to understand about the diagnosis, whether patient is suffering from AKD, CKD, and along with CKD and AKD, whether patient is suffering from hypertension or diabetic or not. Once the diagnosis is done, then what we will do, we have to do the plan, we have to make the plan of care. Plan of care set ultrafiltration accordingly, according to the patient's condition or doctor's advice. We need to set the ultrafiltration. Then second, as per doctor advice, we need to set the blood pump speed. If the patient's potassium level is high, means the patient is suffering from hyperkalemia, in that case we need to provide a dialysis treatment, potassium free. So we will check the doctor's prescription, and as per doctor's advice we will provide the potassium free dialysis. Then we will provide treatment schedule to the patient, which date and which time, in which shift patients will come for the dialysis treatment. So accordingly we are making plan of care, everything like we are setting that dialysis timing. Like generally we are providing 4 hours hemodialysis treatment to the patient. So dialysis timing, ultrafiltration, dialysis set quality we will check and we will prepare accordingly. Then blood pump speed, everything plan of care we will prepare. Then current medication, what patient is taking. Suppose patient is suffering from hypertension or diabetic, so whether patient is taking any anti-hypertensive medicine or not, whether patient is taking insulin or not, or any other medicine as per patient condition. If anything they are taking, we need to understand and we need to know about that medicine. We need to update in their file and we have to discuss with the doctors. Then attach the last copy of prescription in the patient file. Suppose doctor, when the patient went for the nephrologist prescription, consultant prescription, that prescription report must be attached in the patient file. After doing the clinical assessment of that patient, this record also should be updated in the clinical assessment form. We have the clinical assessment form where we can update everything as per patient condition and as per our assessment. So all the report and all the patient condition like vital sign, patient's allergic reactions and conditions, then past history, present status of that patient, everything we need to update in the clinical assessment form, and this form must be in the patient's file. We have some important points which need to be remembered always. First, registration form should be filled out for all newly registered patients properly. Second, all the required data must be filled correctly. Third, a staff patient signature is mandatory in form if required. Fourth, clinical assessment should be done by DMO, and if DMO is not available, then it should be done by a staff nurse or senior technician. All the record, clinical assessment form, prescription and investigation report should be kept in the patient file for record. Thank you guys for watching this video, and hope your doubt is clear now. You got some valuable and important information after watching this video. And we have one question for you: why the consultant is important for the treatment and for any medical procedure? Give your answer in comment box, so we will see your answer and we'll see who is giving the correct answer. Thank you. In case of any query regarding these topics, you can connect with the clinical department of DCDC. Thank you.